Okay, so we're going to talk about B6, pyridoxine peripheral neuropathy. Now there's a mouthful. It's the old say that 6 times or whatever it is. But we're trying to talk about all the different things that affect peripheral neuropathy. I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner. Dr. Gates is a board certified chiropractic neurologist. We treat chronic pain, chronic diseases, and our practice has evolved kind of on its own. And one of the things that we treat the most, some significant portion of our patients are peripheral neuropathy patients. We're in the process of putting together a book on this. And so we're just trying to hit all the different aspects of peripheral neuropathy that we have seen, how frequent it is. I do a lot of the consults in here. In fact, I do pretty much all the consults in the patient screening process. And a lot of people come in and have already tried a number of things because they've been on the internet and researching peripheral neuropathy. And the big ones, the biggest ones that people come in by far is, especially if they've already tried their blood sugar and nothing has worked, which we have a whole presentation on that you can look up. But B6, B12, and alpha lipoic acid. I mean, B6, B12, alpha lipoic acid, and people are taking it, whether it's helping them or not. The vast majority are taking it. So we'd like to bring a little clarity to that for those of you who are taking that and you're not seeing any change, or you're seeing change, and why you saw the change, and kind of give you a little bit of maybe some tools to where when you go to the vitamin store to know whether you should be bothering with that or not. So B6.
And taking B vitamins, it almost drives a lot of those working in the neurological community crazy, because almost every patient with peripheral neuropathy invariably comes in taking B vitamins, B12, B6, right. B1. And the really interesting part about B6 is that it can cause peripheral neuropathy if you take too much, and it's actually very easy to take too much of this stuff. We have seen
if you don't
cases,
need it.
Yeah, especially if you don't need it. We've seen cases where people were taking nerve support formulas, and they ended up with a horrible form of peripheral neuropathy. The interesting part about B6 toxicity is that not only can it result in your garden variety peripheral neuropathy, but it can also result in something termed a neuronopathy. Neuronopathy is a fancy word that means where the nerves come from your arms and your legs, and right as they go into your spinal cord, there's this little thing that sticks out, and it's called the cell body. It's the brains of the nerve. And that is preferentially affected when we have a pyridoxine overdose.
But Doc, these are water-soluble vitamins. That's not supposed to happen.
Well,
I read it on the internet.
There could be too much of a good thing. And in that process, and if we get pyridoxine toxicity and these little brains of the nerves die, then patients end up with lots of times horrible numbness, loss of balance, because they can't feel anything. Their brain can't get any sensory input. And so those are pretty destructive. And
I say that not out of jest, because I've had people tell me that, and they go like, well, you can't take too many B vitamins because it's water soluble, and you can see it when I'm peeing out there, because most people are not taking a complex, but if you're taking B6 and you're taking it for something other than that, because a lot of people take it for a lot of different things.
Yeah. And absolutely, it's not only in nerve support formulas, it's in formulas for premenstrual syndrome, carpal tunnel syndrome, schizophrenia. It's been used for that. It's been used for autism.
Brain function. Yeah.
And so just know you can take too much of it, and reports have indicated taking as little as 24 milligrams a day can result in these horrible destructive effects of pyridoxine toxicity, peripheral neuropathy. Now, for those who have a deficiency in pyridoxine, really the most commonly acknowledged cause is Isoniazid. Isoniazid is a drug used to treat tuberculosis, and most medical doctors are really familiar with it because it's on all the medical boards. So basically, if they're taking Isoniazid, it depletes the body of B6.
It's on all the medical board and the testing.
Exactly.
To get your license.
So they have to know that. They have to know to give patients who are on Isoniazid a certain amount of B6 a day. Penicillamine can decrease B6 stores in the body. But anyways, basically, other conditions that affect the absorption of B6 really affect the absorption of all B vitamins. And we've been through those with the B12 lecture. But basically, they entail things like celiac disease, inflammatory bowel disease, which includes Crohn's and ulcerative colitis, tropical sprue, infectious gastroenteritis that seems to last for a long period of time. People who vomit a lot, alcoholics can have a little bit of B6 deficiency. So those are the things that result in a paucity or lack of B6, and that can result in your garden variety peripheral neuropathy, where basically the nerves start to degenerate down there in your feet first, progressing up to the knees, can go to the hands. And these patients who have B6 deficiency can have numbness, tingling, and or burning sensations in their feet. So that is kind of the skinny on pyridoxine.
Well, and given that that's everywhere, believe me, that is written everywhere because it's easy to sell you a B6. Right?
Oh, absolutely. They're all
what percentage? Let's finish up with what percentage of people who come in with peripheral neuropathy actually have a B6 deficiency?
Oh, very few in our clinical experience.
That's the point. That was a big point. It's small. It's a small percentage. 4%.
I would say less than that. We see a lot of peripheral neuropathy.
And we see a lot of peripheral neuropathy. But the thing is, when you're out there reading about it, it's everywhere. So it makes you feel like maybe it's 50%, maybe it's 90%, maybe it's like 4% or less.
Yeah.
Okay.
And it's again people who are trying to sell you something. It's these neuropathy support formulas, bodybuilding support formulas that can result in this.
And again, we're not anti-alternative medicine. We're not anti-supplements. We use it. But you need to be evaluated to determine if is it even in your history? Does it even look like you could have a deficiency? I mean, we treat tons of people who have celiac, but it's still less than 4% of our people or less that actually have that problem. And so that's the thing that I see, people thinking like everybody's on it. So I mean, I get the feeling that it's presented out there as we'll take B6. I mean, how many people do we have in here who are taking B6? And what if you take B6 and you have alpha lipoic acid problems? And you take those things and you get better, well, you find out why you need B6. Because it doesn't take a whole lot for you to be taking too much. So you really need to get to the bottom of that too. But now I think, to me, that covers it, because those are the questions that I get, and those are the things that I get to feel like a person who would be searching would be looking for. So hopefully that's helpful. If you have any comments on this, or you want to contact us, or you want to read any of our other stuff, or view or listen to any of our other stuff, then
go to powerhealthtalk.com. You can like our Facebook page. And one last little tidbit is that we do work with a lot of peripheral neuropathy patients where we try to figure out what the underlying cause of the problem is, and then trying to rehabilitate the nerves back into life. You probably have seen that in some other videos. But we had a case of pyridoxine toxicity, and it was very difficult. The nerves just were not responsive. That's one isolated case. But anyways, thank you for watching, and we'll see you soon.
See you next time.